Hello everybody and welcome to this webinar. This is about supporting skipping student assessment in the practice area. This has come about some feedback from our students and some of our practice learning colleagues across the UK, just about really the application and interpretation of the 2022 standards for specialist community public health nurses. That's a mouthful in itself, isn't it? Or skippings as we all call them. I know there's one or two people in the chat saying they can't hear. Everybody else seems to be able to. We've done a quick check. So if you can't, it's maybe you can't hear. If you can't, I'm giving you advice that you can't hear, so that's not any use. Simon, if we move on to the next slide. Just to let you know that this session, right up until the question and answer section, is being recorded. In fact, we could probably keep it recording for the whole session if we're going to keep people's mics off. The way, just to make it easier for the session, apart from presenters, everybody's mics and cameras are disabled. That just makes it a little bit smoother. But our chat box is on, and my lovely colleague Jules is there on the chat box to be able to answer some questions as we go along, and also she'll pull any pertinent questions or themes together that we'll discuss at the end. So just to let you know that. It is being recorded, it will be uploaded onto the NMC website and available. So we just remind you, obviously, everybody, for confidentiality, if people are sharing areas they work and things like that, just to, you know, be mindful of what's being put in the chat, really, that's all. The chat box won't be on the NMC website, only the recording. And the questions are there. I am supported today, as I said, by Jules Dixon, who is another NMC Nursing Education Advisor, and by the wonderful Simon in comms, who is very good and supporting all of the IT and the stuff that goes on behind the scenes that we absolutely need. We also have got a selection of excellent external speakers for you today, which I think is probably going to be much more interesting than hearing me speak. So we will just get started. Thank you. Next slide. Just to give a bit of an overview, so the session is about supporting student assessment, like I said, around the 2022 standards. We're going to have some case study examples from us, and more importantly, some examples about assessment from a couple of students and a couple of practice learning partners, as we call them, out in practice, which I think will be really valuable for you. The idea is just to, it's obviously we know that learning is very different for everyone, and we'll discuss that as we go through. We're hoping the session will be around 40 to 45 minutes presenting, and then there will be time for question and answers at the end as well. And like I say, you can put them in as you go along, as you think about them. Next slide, please. Okay, so just to recap, really. Sorry, I was just looking at the other screen because sometimes the slides look a bit different, don't they, when they come up? Okay, so just to recap, so these first few slides is literally just recapping, which I'm sure everybody will always know, but these are the key points we get asked about within to do with skipping and students. So the first layer of boxes there you can see is about pre-registration students. So those that are skipping practitioners out there, and about supervision and assessment of a pre-registration nursing student. We get a lot of these queries on a weekly basis. The main thing to remember is that to be an assessor, so we talk about assessors first, to be an assessor for a pre-registration nursing student, you must also be a registered nurse. So that means if you're a midwife and a skipping, then you can't assess a pre-reg student nurse, but you can supervise them. The other part of the standard says that you should be a registered nurse with knowledge, equivalent knowledge and experience in the student's area of practice. So that means that you can assess the student against the proficiencies as they are for pre-registration. So remember, when they're out in skipping practice, they're not there to learn to be a skipping as a pre-reg, they're there to learn about the complexities and determinants of health and community working and all of the wonderful things you do. So if you are an adult nurse and you have a children's nursing student, for example, as long as you feel you've got knowledge and experience and to be able to assess that children's nursing student against their proficiencies in the context of children's nursing, if that makes sense, certainly all of the health visitors and school nurses out there, I would say, would have quite a lot of knowledge and experience relating to the health and well-being of children. to do that. But that's for an individual and employer to decide the knowledge and experience bit. But you must be a registered nurse. I've seen this come up in the chat box, but so I'm not keeping an eye on that as we go along, so it distracts me. But the second bit is about post-registration students. So yes, if you are a qualified SCPHN, as long as you've completed your preceptorship, you are able to assess. Not are you only able, but it is part of these 2022 standards. So you are now required to be engaged in the education and supervision and assessment of another SCPHN student in your area of practice. So, for example, a health visitor who has completed preceptorship can assess and supervise a health visiting student. I can see there's probably lots of questions coming up there already, but Jules is busy, and I wish I could disable that little bit that's coming up. Next slide, please. The next few slides just really indicate, and it's just for a guidance to you, the part of the standards that this refers to, just for clarification. So part 2 is our standards for student supervision and assessment. They're all available on the NMC website. You literally can put into Google NMC standards for student supervision and assessment, and that will come up. We do always signpost people to use the versions on the website because they're much more up to date. If anything was to change, we would change it on the website, and we try to keep costs down and not have hard copies. So that's where you'll find that. And that just really relates to, it can see there 6.5 that SCPHN students should be assigned practice and academic assessors who are SCPHNs with appropriate experience in the student's field of practice, whether that be health visiting, school nursing or occupational health nursing. Now, quite often we get asked, what if you work across the whole 0 to 19 service? So you may be a registered health visitor, but you have experience in school nursing and work across the whole 0 to 19. And if that is the case and you feel competent to assess a student in either of them areas, then that is okay, you can do that. But you must be able to assess them. Remember, the standards are different for health visiting and school nursing, and so you must have the skills and knowledge to be able to assess them in relevance to their standards, so to be able to understand the field that the student is studying. Okay, and you must have completed preceptorship. So that's really important that we're not allocating practice supervisors or assessors to SCPHN students who have just got, a newly qualified SCPHN. Seems a little bit unfair as well, doesn't it? Okay, next slide, please. Okay, this is just another part of the standards. So we have lots of parts of standards, as you'll be aware of, here at the NMC. Part 1 is our standards framework for nursing and midwifery education. Part 2 we've just mentioned for our standards for student supervision and assessment. And part 3 is our post-registration. We have got pre as well, so do watch if you're trying to download it, but post-registration standards. So in here, again, it just says exactly what I've talked to, but it just really highlights the part of the standard. So this bit talks about the preparation and support that supervisors and assessors should access and are required, and it is their responsibility as well to access when supervising a SCPHN student. So it is the responsibility of the university and the practice partners of the employer, as to speak, the practice partner area, to make sure that there is adequate preparation and training and support to support you in the supervision and assessment of SCPHN students. That will look different in every area. Quite often it is led by the university and the programme leads for SCPHN, but you may also have additional sessions in your university. And the idea with that is really that you understand the programme that the SCPHN is on. Some of you may work with SCPHN students in different universities, so the programmes may look a little bit different. I know there are a couple of our health trusts out there that have got students across different universities, so it will look a bit different. So attending them is really important. Some people use the Pan London assessment document, which is across the countries now. In Scotland, I believe it, both England, Scotland, Wales have got their own, and Ireland have got their own documents. Other universities have got their own approved practice assessment document. So attending them sessions will really help you support the student in the best way possible. Next slide, please. I know why it looks different, Simon. I forgot you'd made it all corporate looking, hadn't you? That's what's confused me as we go along. Okay, so we talk a lot, don't we, about practice assessment, and it is really, really important. So although today we're going to give you some a little bit of guidance or try and signpost you to some things, actually what's really important is that it is a requirement that we look at students individually. Okay, so everybody learns in a different way, and we know that, don't we, from ourselves, and when we were possibly doing skipping myself or doing our pre-reg nursing. Some people are visual learners, some people like all the theory up front, some like it as they go along. And as a supervisor or an assessor, it's really, really important that you have them conversations with your student and that you make some form of assessment. It doesn't have to be through it can be through validated assessment tools for learning tools, or it can just be through them conversations and that observation that you're having. But, you know, these are qualified. Remember, our skipping students are already registered nurses and midwives with quite a breadth of knowledge and experience. So they bring that to this learning journey. And it's really important that they're learning on the programme reflects that, and that it's not a one-size-fits-all approach. And we know, for example, some people are midwives that want to do skipping, and actually handling a newborn baby, and if they've been a community midwife, knocking on someone's door in the community, you know, will be really comfortable for them. And so that's not necessarily going to be something that is a learning goal for them at first, where for other people, you know, we know of students that, for example, have maybe only worked in theatres and might not even have worked with conscious patients. So then going out into the community is very different. So their learning needs are all really different. And how you map that learning is really important to really demonstrate that individual approach. It's important that the students feel able to know what they're working towards, and so that scaffolding approach helps. Okay, so what are the students aiming to learn at various stages throughout the programme? You know, taking it in bite-sized chunks and making it really individual, and that they know that it's that three-way conversation between the supervisor and both assessors. So within this, we know that we're using that three-way approach with our academic assessors and our practice assessors and our practice supervisors that are feeding into that, and they're really gathering where the student's up to, what the next stage of learning is. And what students tell us is actually where they get confused is that when they don't know what they're aiming towards, so they don't know what their next step of learning is. And actually they like to feel, and it's really important, we all do, don't we? We like to know what we're working towards, and we like to know that progression is planned. Reflection and feedback, obviously, we know it's part of the standards, it's part of SSA, and that should be continual. And it's whoever is taking them. So even if you're not the named supervisor or named assessor, but you're working with that student that day, you're a registered SCPHN, and so actually it is your responsibility to provide that reflection and feedback on a continual basis. Some of that will be formal sessions, some of that will be discussions in the car, some of that, you know, and maybe but it's really important that you have that feedback with the student, but you also have that feedback with the named supervisors, and the named supervisors feed into the named assessors. So that's really important, because it's practice assessors can't make their assessment without that really valuable feedback from the practice supervisors and the range of supervisors that the students are working with. It's what really helps as well, and certainly this has come back from students, is that actually if you do understand the programme that the student is on and what's going on in their programme, that you're able to scaffold the learning and practice that matches what they're learning in university. And that certainly comes back from students a lot. And like I say, that will look different for every university, and what goes on in the programme may be different. But if we think of you know, research, for example, and that should be in everything, but actually when they're doing the research module, how do you support them to really understand the evidence that's been applied in practice and really relating that in everything they do? Quite often we get asked that, you know, well, how do I embed that? And you're like, well, actually right from the beginning, aren't you? Right from the beginning, you're using the evidence from audit, from policy, whether it's from NICE guidance or NHS guidance and directives, or whether it's from empirical research out there, that actually everything that is being provided and all the information that's given reflects that, but that students are really able, certainly in the beginning, they're able to understand that underpinning evidence. Next slide, please. I think I've talked about the next slide. Yes, I have, so we can and move on. Thank you. Move on to the next slide. Thank you. So a lot of what we want to talk about today really, and what our external presenters are going to talk about really, is about how do we assess students. Now I know a lot of you out there will be very experienced practice assessors for skipping students, so bear with me, because actually you probably have lots more ideas than this. Now what we say is, obviously it's individual, but it's a range of different strategies that you should be using. As a practice assessor, what the SSSA standards say is that you have opportunity to observe the student in practice. We don't tell you how often you have to do that. That would be individual, as you would know, because that would depend on the stage of learning and the stage of, any concerns you had, any confidence you had, what it was you wanted to observe really. And every practice assessor will do that a little bit differently. It's probably worth having them honest, transparent conversations, I think, with your students at the outset and saying, this is how often I would like to observe. I know practice assessors sometimes like to observe every mandated contact at one point before they say that they're competent. Others, it's about actual, discussions that they have, and that's absolutely fine, letting the student have that discussion. What have they done? How have they linked the theory to that? How did that fit in with all the directives? What did they notice? All of those things that happen. And then reflections. Now, I'm not going to sit and tell you to make them write a written reflection. I think they have a lot of work that they have to do at university and that they have to put in as part of the practice assessment document, without me telling them to write more. But actually, how are they doing that? Some students map the reflections, in reflective diaries quite a lot, and they're really good ways of demonstrating learning as well. Some students do case studies, and that's an excellent way, but equally having a discussion about a case study would also be a very good way to demonstrate competence of achievement as well. So as you can see, there's lots of different ways that you can assess student competence around the proficiencies. It doesn't have to all be that formal, I've observed you do it so many times, or I've seen a written reflection. Actually, we know some people write really well, but actually in practice it's a little bit more challenging, isn't it? Or vice versa. Next slide, please. Okay, so this is a really good point to bring in Sophie. If we go on to the next slide, and then I will turn my mic off, and Sophie, I'll let you put yours on and come speak. Sophie's one of our students.
Hi everyone, my name is Sophie Connor, and I'm a health visiting skipping student in Sheffield. So as you are all aware, there are quite a few proficiencies, and I know for me, when I first saw them all, it was overwhelming, and I just thought, how on earth am I going to keep track of these, keep them all in my head, and sign them all off. And I just kept flicking through. So I printed them out and I just kept flicking through the folder and thinking, gosh, I've already forgotten what was 5 pages ago. And I just wanted to see it all in one place, was the main thing, I suppose, because with it all being online, it felt very abstract to me. And I wanted to have something a bit more tangible. I wanted to have a bit more control. So I made this table. It's really very simple. I just put all of the proficiencies in the chart in a way that I can see exactly what my progress is, and I put an example on here on the slide. And so as I go along, I can kind of see where I'm up to immediately. That was the main reason I did it. I suppose as I've gone along, I've found other advantages to it, in that when I'm providing evidence to have things signed off, I'm not repeating myself, so I can make sure that everything I write is targeted to the gaps that I have, rather than so for here example, A1, that's done, demonstrated. I don't need to keep providing evidence for that over and over again. And I think personally, as geeky as it sounds, I learn best when I'm having fun. I don't take anything in if I'm bored, so it's just a bit of a game for me, which is why I've called it proficiency bingo. yeah, just I'm quite competitive too, I suppose. So it's a bit of a challenge for myself. Or what can I, or, how many boxes can I get green, this week or whatever. And yeah, that's it really. Very simple idea, but it's helped me, and I know it's helped a few other people as well. So I'm hoping that even if it just helps one other person, that would be good, wouldn't it?
That's lovely, Sophie. Sophie's been very discreet then in the fact that she's not acknowledging that her whole trust has taken this on board for students, so and wider, I believe, in the area that she works. So absolutely brilliant. It's like a matrix, isn't it? And so she's been very coy and saying, oh, it's just a bit of fun, but actually it's a really good evidence-based matrix, I think, that demonstrates learning and as she goes through the programme. Sophie, if she's happy to put her email in the chat box, and then if anybody wants to discuss that further or have a look at the full matrix, I'm sure Sophie can be in touch with you personally then. It's easier to do that. Thanks very much, Sophie. Well done. Next slide. So this is just a bit of an example, because when we talk through, sorry, things coming up all over the place. When we talk about proficiencies, nothing's done in isolation, is it? It's always, you can probably guarantee that everything a student does at any point will meet a real breadth of proficiencies. And I know certainly when our practice assessors talking a bit, and our next student, they will also talk about the number of proficiencies that can be met. So what we've done here is we've just put a little bit of a case study together, but this was one of the proficiencies that a lot of people ask, how, because it's new, isn't it, this one about developing business acumen, and how will students demonstrate that in practice. So in this case study, this is, well, for example, it will be different, I know, in every area, but in this case study, a student goes out to do a routine visit. What they notice on this visit and this home visit, the developmental check, but actually they notice that the parent is feeling a little bit isolated. So they develop a really, that therapeutic conversation. What is it that the parent would like to do? What can they access? Within that conversation, it comes about that actually there's not a lot in the community that this parent and child live. It's quite a deprived community, and a little bit further out without easy transport access to nearing towns where all of the resources for health and social care, leisure, that type of thing are accessible. So the student has this conversation about what the parent would like, and then takes that back, and through reflection with their supervisor, they identify some things that the student can do. So the first thing you'd be doing is either completing a community profile or perhaps updating a community profile that had recently been done in the practice area. And by doing that, that really helps identify what services are, what the health needs are, what the social needs are, and what is really prevalent for that area. Okay, sorry, I'm just going to take them off. Through that discussion, then further actions are planned, in that the student then can look at what resources are in the area itself. They identify that there's not a GP surgery, but there is a school, there is a local community hub, so whether that be a church or a hall that people access for sessions and parent and toddler groups and things like that. But actually it's a close-knit community. It's just that they don't have regular transport, they don't have regular access. It is quite a deprived community, so financial resources are low. Not everybody has access to a car. And what they identify there is that actually this community aren't getting access to all the health information and the key health messages that they could. So through collaborating wider, so within the wider SCPHN teams, even so within 0 to 19 teams, occupational health teams, they can work through with education, with sports resources, local councils and housing teams. You can bring together and map what resources are available. And this doesn't have to always be something that is big and costly. It is also important that the student is able to recognise how commissioning would go about, so that they do then cost analysis. As if you were to input extra services, what would that look like? What would resourcing look like? We're not saying that every student has got to go out and make sure they get commissioning for a new project every time, but they do need to understand what it would look like in that area, and what strategies would need to happen. So through that really helps the student understand about resourcing, about identifying gaps, about putting innovations into practice. They can then, for example, develop some key health messages and make sure that them health messages are delivered locally in the area that these people live. So whether it's that they're going into the schools, whether it's you're going into these community centres or community resources or town halls, and that can be through oral presentations and attendance at groups, that can be through posters. Quite often now I've seen a lot of students develop QR codes for information, which actually when we're moving digitally even, I don't know if I can say that properly today, that really helps bring together a wealth of information. And you can see through that the range of, just by doing, and that would take some time, I know it could take months, but actually that would be an ongoing piece of work. And by doing something like that and looking into that, you've recognised the gaps, you've recognised where health innovation improves access to health information, and all of that interagency and collaborative working, and that really develops that business acumen approach. And so you can see the amount of proficiencies that could be met by developing and considering something like that in practice. And I think Kirsty, next slide please. Our next student is Kirsty, and I'll let her introduce herself, and she has got some even better examples to share with you. Thank you.
Hello, my name's Kirsty. I'm a student health visitor currently working in Derby City and doing the course at Derby Uni. So I'm just going to give you an example of practice which met quite a few proficiencies. So myself and my supervising health visitor were invited to attend a strategy discussion meeting, which was held in conjunction with multiple agency teams to discuss a family that had recently come to the attention of social services due to some concerns reported to them from the school. Prior to the meeting, I reviewed all the children's records, collated the relevant information with a view to me taking the lead during the meeting from a health perspective. In the meeting was police, social services, housing, school, nursery and health. All the professions took turns to share the information they had regarding any contact or work that had been completed with the family to date. A little bit of background on the family. It was a mum and dad who were married, had 3 children together, living in the family home, 2 of which had global developmental delays and complex needs and autism diagnosis, and the mother also had a learning disability. The oldest child had limited language for her age, and the other 2 children were non-verbal at that time. During the meeting, I took, sorry, I've lost my train of thought. Different professionals shared concerns relating to the children and the wider family dynamics, including how the family were managing the behaviour and interactions between the children, and the complex behavioural needs, including things like locks on doors and window barricades, and the family seeking cures from religious and spiritual leaders and performing cleansing rituals, and that had been disclosed from the oldest child to the school. During the meeting, I took the lead in sharing the relevant health information for each of the children, including things like the GP visits, immunisation status, development review attendances, and observations of the home conditions and parental interactions during the home visits. During the meeting, it became quite clear that there were some inconsistencies between disclosures made and observations made by the various professionals working with the family. And when it came to giving our final thoughts around concerns and risks to the children, I became increasingly concerned that other members of the multi-agency professionals were minimising the risks or the impacts on the children and not considering the wider significance of some of the things that were shared, either because they were blaming a lot of the issues on the children's behavioural needs, and parents using potentially inappropriate methods to cope with the children's behaviours. I think also there was a factor that some of the professionals didn't want to come across like they were being culturally insensitive or disrespectful, which, although is understandable, we do have to be sensitive to differing cultural views or practices. It's important we're still aware of the child's voice at the centre and how they're experiencing the world around them. This meant that when it came to my opportunity to discuss my thoughts and opinions after having listened to everybody else from a health point of view, I had to make some quite respectful challenges, I would say, to other professionals during the meeting to ensure that the child's voice was not being lost amongst all the social issues, and that they weren't minimising the impact of what was happening to the children for fear of coming across as culturally insensitive. As part of the leadership side of the skills that we need in the role of the SCPHN, we have to be able to make respectful challenges with other professionals and ensure that the child's voice is heard, and that being aware that other professionals may not have the same priorities or knowledge or experiences that ourselves may have, or aware of the impacts. And that always remembering that effective safeguarding requires a coordinated and robust approach between the professionals, and that information sharing and accurate documentation play a crucial role, and that when that fails, we're not protecting children from significant harm or even death in some cases. And being able to identify the concerns at an early stage in something like a strategy meeting allows for prompt support and reducing that risk of harm. And also knowing that when we complete our assessments, our 6 to 8 week reviews, our 1 year reviews, things like that, some of the findings might not be concerning in isolation, but when they're put together in the bigger picture, they may become more concerning. Once the meeting had finished and we'd gathered all the actions requested for the health visiting service, I documented the meeting on the child's records and all the actions, and then put a plan in place to make sure that anything we needed to do was completed before the next meeting. So this experience, I think it was about 12 proficiencies that met. They were the A4, so select and apply relevant legal and governance requirements, policies and ethical frameworks to the SCPHN practice, differentiating between the devolved legislatures in the UK. A7, so making professional judgments and decisions, working in complex, unfamiliar and unpredictable environments. And B2, identify and evaluate proficiently the multiple use of evidence and use multiple sources of evidence and research relevant to people, communities and populations to inform the SCPHN practice. C2, demonstrate compassionate leadership in applying human rights, equality, diversity and inclusion. C11, lead on, and this was kind of the biggest one, lead on identifying vulnerable people, families, communities and populations, and take action to support, safeguard and protect them, and coordinate timely care, and offer all the responsive support. CHV3, continually assess and skillfully adapt to different environments and complex situations in order to identify and advocate, that's the kind of a big one, for those families most at risk, whilst at all times safeguarding the welfare of the child. CHV7, initiate appropriate evidence-based person-centred interventions and promote healthy relationships, minimise risk of domestic violence, child maltreatment and other forms of abuse within the family. CHV8, use the professional judgment to observe, recognise and respond to signs of abuse and neglect across the life course. EHV2, respect parents and carers' need for autonomy and control with sensitivity to a wide range of attitudes, values and beliefs and expectations and faiths. That was particularly relevant in this strategy discussion. F8, use a wide range of advanced communication skills with people, community, peers and interdisciplinary and interagency colleagues, and the use of digital and other modalities to support communication. FHV3, involve, escalate, report and make decisions with interdisciplinary interagency teams on the immediate and continuing risk of domestic violence and child maltreatment. And FHV4, lastly, lead interdisciplinary and interagency discussions, which a strategy meeting was ideal for that, and make decisions regarding the referral, transfer and support and management of children and families. That's everything from me.
That's lovely. Thanks very much. Oh, sorry, Simon, can we just go back one slide? Sorry, thank you. Yeah, well done. I think get a lot of round of applause there. That's good, isn't it? And I think what it really evidences, isn't it, that actually in any one thing, the standards aren't in silo. That although they look, and I know what people tell me is they look very wordy and they look very complex, but actually when you break them down, there will never be just one standard that you meet in anything you do. So although this next example I'm going to give is just looking at one standard, obviously there will be lots more that come when you are applying this one standard. The reason I've just put this one is because, again, it is a bit different to what the other standards were, and it's one of the ones that students have raised through some of the consultations I've had across the country. Across the country, I should say, sorry, of the UK. So this one, I'm not going to read all of the words out, but this is about your medicine management and optimization. So as you know, although a lot of SCPHNs are currently community nurse prescribers, the new standard, it's optional whether that was put in, and the decision for that would be between the university and the practice partner. I know a lot of places haven't opted for prescribing in SCPHN because of the workforce need, and that may change as time goes on, but at the moment, because it had to be V300 as part of these standards, but that doesn't mean that you don't make prescribing decisions, whether you're actually writing that prescription pad, and I'm sure everybody who is a prescriber out there would verify that. Actually, the prescription is the very last thing you do when you're making prescribing decisions or medicine management decisions. So as a nurse, regardless of what area of SCPHN practice you're in, it's about having knowledge of what is common in the area that you work. So, I mean, I'll use paracetamol as an example because it's very easy to use, but actually we know in children paracetamol and ibuprofen, for example, are used widely, aren't they? So knowledge of them, how do they work, when should they be taken, pre or post immunization, what about chickenpox, and what's the advice on that, you know, and actually why is that the case? So actually it's really important that as a SCPHN that you're not only just giving parents the directive, but actually you're saying why, so that they really do understand the mechanisms behind it, and that you're able to support that effective use. So making that whole decision, able to support parents and recognise when to use it and actually when it would not be appropriate. And what about any contraindications with other things and any side effects that might happen? A lot of people now use herbal medication, but we know that some prescribed medications, or equally for children, some of those aren't suitable. So it is really important that regardless of what area you work in, you have that knowledge about making that whole decision about future prescribing or prescribing decisions. So that means actually, would you signpost someone to the pharmacy? Would you signpost them if they've got a dry skin? Would you know what would be the appropriate cream to recommend that they go, and whether they get that through free pharmacy initiatives for certain people, or whether they are paying for that, or whether you're signposting them to GP services. But actually you're able to support that decision and able to make that whole assessment of the person and really know what is the specialist services about. We refer a lot, or use, I say we because I still think of myself as a bit active SCPHN, refer a lot to dietitians, don't we, a lot. And so actually what is that advice that you're looking for, and actually how are you supporting the family prior to getting that appointment with the dietitian, and really being able to evaluate the outcome of that. So you've signposted someone to a dietitian, and actually how is that working for them in reality, and being able to really pull that all together as their SCPHN practitioner. So there's a lot in that, and that seems big, and there will be lots of other areas that you can think of that actually you do apply this. Particularly clinics are probably really good ones, and where you do a lot of assessment and have these conversations just without even realising that you're having a bit of a polypharmacy conversation there with somebody and making a decision or a signposting action. Okay, that's just next slide, please. So now we have our practice assessors from Stephanie and Lindsay from Harrogate and District. It is Foundation Trust, isn't it? I will hand over to them now. If you just next slide, please, and then I'll leave it to you when you want your next slide. Thank you.
Hello, we probably can just jump straight into the next slide. It was just a little bit of an introduction, really. We are looking at how we've kind of supported, assess and sort of facilitate the new proficiencies into our service area. So can we have the next slide? Thank you. So ultimately, we have obviously seen sort of the real value in our partnership working with higher education around this. We obviously needed to really understand kind of what this was going to look like for us as assessors as well as our supervisors to incorporate the proficiencies. So we did actually hold sessions for practice assessors and supervisors within the trust. This was sort of protected time for us all to be able to kind of review those proficiencies and really get a good understanding of kind of what that meant for us to be able to apply them to practice to give our students those best learning opportunities. We also kind of had meetings with supervisors and assessors from our with our partnerships in the wider footprint, so that they could kind of we could all sort of share good practice and ideas in respect of how to incorporate the proficiencies into practice. Can we move to the next slide? Sorry. So basically coming together, we were able to identify lots of opportunities in just basically our everyday practice. So although some people kind of were worried around, as you've already mentioned, what the proficiencies read like and what that actually meant in terms of people's individual interpretations. So we were actually able to kind of map what that actually looked like, just using things like our core standards and other learning opportunities in the local area, to kind of highlight what this could actually look like for the students. And I think really importantly, as assessors and supervisors, we do periodically link in with our SCPHN students, just to kind of get their understanding and kind of look at what they feel like their learning opportunities are. As you've mentioned, everybody has different sort of learning styles and sort of thoughts and views and ideas of how they can kind of achieve things. So that was a really big and important part in being able to incorporate sort of the proficiencies into practice so that they can get the most out of their experience. And obviously took into consideration, because of some of the proficiencies being a little bit more sort of unusual to what we have had previously, taken into consideration using like the practice like the alternative public health learning experiences to maybe achieve sort of those ones that we might not necessarily get done through our core standards and contacts that we deliver in practice. We have got some examples of opportunities that we have used, and Stephanie's going to take you through some of those now. So if we could have the next slide.
So this is just an example of an ordinary Healthy Child programme visit, just an ordinary contact that we would do on a day-to-day basis in practice. So we're both health visitors by background as well, just so you know where we're coming from with this. So we'll be looking at things like health needs assessment, including your wider determinants of health. The advice we would give, things like immunisations, infant feeding, baby brain development, bonding, attachment, all of this that we would do ordinarily. In Sunderland, in this area, we complete carbon monoxide monitoring at antenatal visits and then all subsequent visits up to and including the 9 to 12 month. Whatever advice we give is evidence-based. So obviously that would link in with some of the proficiencies around that. Thinking about genomics, if it's an antenatal or a new birth visit, looking at the blood spot screening. We have had an increase in sickle cell in over recent years in this area, so discussing that with families, supporting, signposting appropriately. In this area as well, we also issue the Healthy Start vitamins to mums antenatally, and then to their babies, mums for the babies if they're breastfeeding, and then for all babies around 6 months, around the time they're going to start weaning as well. That would come into kind of medicine management, dosage, safe storage, how we record it in patient record, things like that. We do complete routine heat assessments here as well. I think most areas in the Harrogate footprint do. So that's a home environment assessment tool looking at prevention of accidents and basically safety in the home, which also links in with your high impact areas as well. And then advice around things like common childhood illness, the advice we would give managing those minor illnesses at home, so signposting to other areas. Just Elaine give the example of pharmacy. And we've also got use of apps and things, so there's digital resources as well. So when we looked at just an ordinary visit, that would meet potentially 51 of the SCPHN proficiencies. Can we have the next slide, please? So this next slide is just an example of some partnership working that we've done with the local college over the past couple of years. So they hold an early years conference for their early years students, and we've been one of the partner agencies that have attended, along with other partner agencies that we work with on a regular basis. And you can see there the BBC Tiny Happy People. That's a resource that's absolutely evidence-based. It works with the Institute of Health Visiting and other kind of appropriate services, and we signpost to that resource quite a lot. So that was just an example of another partner agency. And we delivered 2 sessions. So the middle slide is one of our SCPHN students. I have had consent to use these photographs as well. That's one of our SCPHNs delivering the dental health session. The other group of SCPHNs delivered 1,001 critical days, and it meant that as assessors, Lindsay and I could go along with the students and observe them as they were delivering the sessions. It's a brilliant event for partnership working as well. And I think the next slide, please. That just really demonstrates some of the proficiencies that could be met. That I've looked at the dental health workshop particularly. So that was quite an interactive session. So the student took along the great big toothbrush and teeth, gave a demonstration of how to brush a child's teeth and let the students participate in that. And some of the students from the college actually had placements in nurseries that were involved in the supervised toothbrushing scheme. I don't know if anybody's heard on the news last week, the government announced that scheme is going to be countrywide now, but at the moment it's just certain pilot nurseries that are doing it in the area. So there was different kind of activities for the students to do. And when we looked at what proficiencies could be met, there was potentially 57 proficiencies could be met just by kind of this workshop. Sphere A, if you see the proficiencies there, the potential one is looking at kind of the differences in access to dental health within the devolved nations. So in Scotland, dental health is free So that's no cost to the population, whereas obviously it's different in England, there's differences in Ireland and Wales as well. And so it's just about the student demonstrating that they are aware of those kind of those differences. So, and that's it. I think we're on the question.
Next slide is just to say thank you.
Thank you very much. That was excellent. And I think some really good examples of real breadth of learning that can happen within skip and practice against these as mapped to these new standards. So thank you, ladies. That's been really good. I think we'll go straight to our question and answer. We'll leave that, Simon, go straight to question and answers now. Jules, I'll come to you.
Thanks, Elaine. And wow, what a busy hour I've just been having. It's really tested my grade 3 CSE typing skills beyond what I'm used to. So some lovely questions in there. I think I've covered most of them, so I won't kind of ask you to go over there. But lovely question by Alex, which I didn't think that Alex was saying was quite right, but I thought I'd get you to just describe that. So Alex asks, our uni told us that if you want to go and work in another field, then you won't need to go back to uni. I'm an occupational health nurse and rep for my course. Some of the health visitors are interested in occupational health. So am I correct in stating that they would not need to attend more courses to change that area once they have qualified?
Not truly correct. No, you're right, Jules. These SCPHN standards, remember, you've got your core standards, which everybody, regardless, so, you know, a public health nurse, health visitor, school nurse, occupational health nurse will do. The others are very different. Where there is overlap between health visitor and school nursing, to age dependent, you know, we look at health, you know, certain things, but actually the occupational health ones are very different. So what you have to do, yes, you can only be registered as a SCPHN once with the NMC. So that bit is correct. You can go and do, but what you would have to do is evidence that you would learn then proficiencies as an occupational health nurse. So if you were a health visitor, for example, and wanted to do occupational health nursing, how you would do that is you would need practice learning time with an employer to get them practice hours and that practice experience. And you would also need some form of what we call recognised prior learning through the university to say how you would learn the theory of occupational health nursing. Now you can do that and you can do that with any field of SCPHN, but you can't call yourself anything other than your original qualification. So you can call if you are registered with the NMC as a SCPHN health visitor, the whole time you register and revalidate as a SCPHN, you will be a SCPHN health visitor. So you can't call yourself a SCPHN occupational health nurse, even if you've done that additional training, or a SCPHN school nurse. You can call yourself a SCPHN and work in occupational health if you've completed the learning and if they're happy. If your employee, that would be a decision between your employer and the university about how you RPEL'd. So usually what RPEL would look like with these standards is you would map all your learning to the core standards, and then they would support you in developing learning to them additional standards as well. So you're right, Jules, it's not quite as simple as saying I can just go and get a job in another field.
Yeah, thank you. And thanks, Alex. And also Zoe appreciates the response as well, because that was more of a nuanced one that I couldn't quite type up. And to be fair, I'm not quite sure I could have articulated it quite as well as you've just done, Elaine. So there were some other kind of questions as well. So there are a number of students on the call who are doing their SCPHN using the previous standards, and so they were querying whether the learning about the new standards was relevant. I suggested that they are going to require those moving forward, but I didn't know if you wanted to add anything to that.
It's exactly that. So although you are being assessed for your programme only against the previous standards, if you are a continuing student that started before last September, you absolutely need to be cognizant of these standards for practice. These aren't just standards for students, and I think everybody is aware of that. These are standards for all SCPHN practitioners. So you are assessed as a student against these to say you're competent as a SCPHN practitioner to go out and work as one in practice at the end of your programme. But every SCPHN practitioner out there needs to be applying these standards to their practice. So absolutely, even if you're working if you're continuing an auto program on the old standards, you absolutely need to be very aware and applying these standards in your practice.
Thank you. And you know, that question has just set another little flurry of queries. So there does seem to be some queries around the different SCPHN. So if you're a registered SCPHN school nurse and you complete the SCPHN health visitor program, it was my understanding that you could be annotated on the register as SCPHN HB as well.
No, that's wrong. Sorry, there's no other way to put that. You can, for regulatory purposes, for safety and to maintain a really robust, strong register and know where people are working, you can only be annotated. Well, it's not an annotation at the moment, it's part 3 at the moment. So you would only be on part 3 under your original qualification. It wouldn't be it's not an NMC approved program if you do further RPEL. It would just be learning in practice in conjunction with your university. It wouldn't be an approved full SCPHN program.
Okay, thank you. Although Alex continues, should we only reference the old standards in any reflections, or should we also mention the new ones?
Oh, well, I'm from the NMC, so I'm obviously going to tell you that mentioning the new ones would be excellent evidence of learning. What your universities say, do what they want you to do to get through the course. But obviously, if you reflect on these, then you're really going to demonstrate excellent learning.
That's lovely, and thank you. Another lovely one from Debbie here, who's over in Wales. Hi, Debbie. Or I can't remember what good afternoon is. I can always remember Bore da for good morning, but that is well my limited Welsh. I work as a practice education facilitator in Wales. I recently told that there is no longer a requirement for SCPHN students to do public health days. However, one of the presenters has just mentioned them. Can you clarify?
I absolutely can. So there's not. So public health or alternative practice days were a requirement on the previous standard. So on the 2004.
Okay. Oh, have we lost Elaine? Or has she just suddenly stopped? Which is not alike, Elaine, to just suddenly stop. Have we just lost Elaine?
I've gone. Am I back?
Yeah, you did. Thank you for coming back, though.
Oh,
yeah.
Am I back?
You're back.
Sorry about that. I could hear everybody there. It always makes me laugh.
Oh no, I think Elaine
Am I here?
You're here?
It's individual and up to the university.
Okay, I think I've just heard that would be individual and up to the approved educational institution in order to do that. Sorry, Elaine, if you are back and I am now putting words in your mouth. Oh, Debbie, thank you so much for giving me the Pryn Hawan da for good afternoon in Welsh. I'm not sure what the accent is like. I'm just going to carry on the account that Elaine seems to have left early. And so I just want to double check. I've got some other questions in the inbox. So please, could you ask if SCPHN role is considered specialist? Why is it band 6 and not band 7? Actually, that isn't an NMC-ism or even a SCPHN-ism. That is more of an employer-ism. And so you would need to speak to your employer around that. So sorry, we can't help you any further with that. This one I'm hoping Elaine, please come back, Elaine. What was the full rationale? Oh, good, thank you, because I'm not sure I can answer this one and we've got like a minute left. So I'm hoping to be able to do all of the questions, which would be great. What was the rationale for the practice teacher qualification no longer existing at the NMC? Or this isn't anything to do with SCPHN as such. It was a good area for development to get teacher qualification and a band 7 role. Now it fills to us 2 band 6s to undertake the PS and the PA roles. Not sure if that's a question or a statement. I suppose the question is the rationale for getting rid of the practice teacher qualification? I'm not sure I know the answer to that question. And have we lost Elaine? We've still lost Elaine. My apologies, but what I can do is I can have a look at that and see what that is. Yeah, because like you, I'm also have the practice. I even have an ENB 998 somewhere. and a postgraduate certificate in education. So I'm sorry, I'm not quite sure why that is, although that again could be something around employer issue rather than that. Oh, I can see Simon's coming in. Thank you so much. Oh, now actually another good question, and I'm going to have to stop then, about whether or not you can be a practice assessor for somebody. You do have to be on the same part of the register in terms of the SCPHN, but you can actually be a practice supervisor if you have experience within that same area.
Am I back? Not. No?
You are back. Oh, thank you, Elaine. You are.
Sorry, I lost you when you talked about the practice teacher. So I can quickly go back to that. The rationale for not having a practice teacher is that post-reg has fit into SSSA, so the practice supervisor and the practice assessor roles. And that is about fair and objective assessment. I'm sure Jules told you this. And actually, we still have fail to fail in post-reg. We still have SCPHN people that come to fitness to practice within a year of qualifying. And the only way to ensure fair and objective assessment is not to have that practice teacher role. I was a practice teacher. You get embroiled in everything and they become a second skin, the students. So actually it does limit that fair and objective assessment. We, like Jules said, we can't get involved in banding because we don't just cover the NHS, we regulate professionals across all different organisations and agencies and self-employed. So yeah, that's what that was about. And some areas do still give extra banding for practice assessors, some don't. It's different throughout the UK. Sorry.
No, thank you. No, thank you, because otherwise we weren't able to answer that question. And I feel that actually has probably covered all of the questions. I hope I've covered all of the questions. We've also had some lovely thank yous in the chat box to all of our presenters, and also for me doing the questions. So thank you so much for everybody's engagement. It's felt really, really positive. Over to you, really, Elaine, to end us off there, please.
Yes, thank you very much for everybody. Sophie, I'm not sure if you're still here and if you'd put your email in the chat, because I can see there's a lot of questions about sharing the matrix. So please do get in touch with Sophie independently for that, so she can at least keep an eye on things. I have told her when she finishes the programme she needs to write this up for publication. And we're quite happy to support you do that, Sophie, but I'm sure your university would as well. You've got some very excellent people there. So thank you, everybody. If there is anything else, obviously we developed this webinar in response to the feedback we've got. So if there is any other areas that we can help you with, either in your practice areas, on their own with your students, or as a whole UK approach, then please do get in touch. Thank you very much.